Are you worried about immunizations? Are you worried about what it will do to your child? Let's talk about this. Because we do immunizations, we can have this conversation because we're not worried about children dying from polio or measles or pneumococcal meningitis or Neisseria meningitidis or Haemophilus influenza B. Those are three nasty organisms. But because we do immunizations, we can talk about this. So let's talk about concerns. Parents are worried about the additives in the immunizations. They're worried about how many they get. So there is a lot of science that goes behind these immunizations and behind the scheduling of them and how many you can give at a time. When parents come in with a concern about immunizations, I like to sit down and what to do is share with them the experience I've had before we've had some immunizations. So I came into residency at the tail end of seeing lots of Haemophilus influenza B meningitis cases. And at the beginning of the Prevnar immunization, which protects children against strep pneumoniae bacteria. So the one horrible thing that I was able to witness was the amount of children that were still impacted by these organisms. Now, fast forward 20 years, the last time that I personally took care of a child with strep pneumomeningitis was over a decade ago. So when we look at immunization number that we have them because they can safely be made. We have them because there's a need. The concerns that parents have about immunizations are real. There are rare side effects with immunizations, and if that is your child, that is horrible. I can tell you that after doing this for 20 plus years, whenever a 2-month-old gets their first round of immunizations, it is very rare for these diseases to happen. All of the immunizations that are available today, we have because they were able to be made. Now one can argue, oh, that's capitalism, but one could also argue, how many of your loved ones do you not know because they passed away from polio, or they passed away from measles or diphtheria? And those were years ago, obviously, and so for young people, it's like, well, they wouldn't have known them anyway. At some point, you have to trust the system that has been established to ensure that the integrity of these immunizations is upheld, that the process is followed, that the safety standards are met. There is ongoing surveillance, an ongoing database for clinicians to enter information if there is an adverse reaction to immunizations. Some of those adverse reactions that we see would be a fussy baby for half a day to a day. Some signs would be a site reaction. After an immunization, that would be one of the more common things to see is a local reaction where the needle entered the skin and the immunization was deposited. That usually peaks at 48 hours with its redness, the heat, and how firm it feels. That will slowly resolve after that 48-hour mark. Some people get benefits with heat or ice on the site. Other symptoms that older children can express is that they felt under the weather that night. Another side effect of certain immunizations, which would be the live virus immunizations, would be 6 to 12 days after the measles, mumps, rubella shot or the chickenpox shot, you get a rash. That rash is usually a handful of lesions, a handful of days, and it goes away. And so if your clinician is talking to you about these potential side effects so that you anticipate the potential for seeing this, it will be less shocking. And I have not had a personal patient that has had an adverse outcome from immunizations outside of these few things that we've talked about. There are rare stories of children having problems with immunizations, and that is horrible if that really does happen. But all we have to do is look at the coronavirus and how this disease is affecting disproportionately the elderly or the people that have chronic medical conditions. And if you look at that and you see the numbers of people that are dying from this disease, once again, we can have this conversation about other immunizations because our children aren't dying from polio, our children aren't dying from measles, our children aren't dying from encapsulated bacteria that get into your body and destroy your immune system and kills your child. So think about all these things and consider that there are rare side effects with these immunizations and give them a chance. Talk to your provider and air out your concerns